Hello everyone, I am Dr. Santosh Kumar, Orthopaedic and Joint Replacement Surgeon based in Kolkata, and I am here to talk to you with regards to every orthopedic problems that you have been facing. You can always ask me, and we will be uploading our educational videos regarding various orthopedic problems. Previously, we have uploaded various orthopedic videos, various informative and educative videos regarding hip, knee, spine, fracture and various orthopedic problems. Now, today we will be talking about ankylosing spondylitis. The reason why I am talking today about ankylosing spondylitis is that ankylosing spondylitis is very prevalent in the eastern Indian subcontinent. A very prevalent disease in Bengal, West Bengal, Bangladesh, Bihar, Odisha and Jharkhand. World's highest number of ankylosing spondylitis people are found here. Now, ankylosing spondylitis is not just a disease which affects one particular area of the body, one particular joint. It affects various areas of the body, but predominantly it affects the axial skeleton. What it means is the midline skeleton, and then it affects the other organs also. This is a genetic disease which is inherited in our genes. Now, just because the gene is there, it will manifest, it has a predictable manifestation. It's not like that. The gene can be silent sometimes, the gene can be mildly active sometimes, the gene can be severely active sometimes, the gene can manifest as this way sometimes, it can manifest in this way sometimes, and the gene which is associated with this disease has been identified to be HLA-B27, and this gene can be marked and easily diagnosed. Gene marking is not an issue now. Along with that, to diagnose ankylosing spondylitis, we have certain clinical criteria. There are certain major criteria and there are certain minor criteria. The major criteria include sacroiliitis, uveitis and things like that, and fusion of axial skeleton and presence of HLA-B27, which in itself is a major criteria, and there are certain minor criteria also. Now, one of the reasons why we are discussing ankylosing spondylitis is because it affects the youth. It affects very young people. Before that we have discussed about osteoarthritis, we have discussed about various types of rheumatoid arthritis, osteoarthritis, fractured neck, femur and all. So basically these things affect the seniors in our society, the elderly, but ankylosing spondylitis affects very young people. So it is all the more significant for us to know about that and to treat it and to limit the damage that ankylosing spondylitis does to our body. Now, ankylosing spondylitis is basically a disease of the axial skeletal system. What it means is that the whole spine is affected and the hip joints are affected. So this is basically a disease of the axial skeletal system. Now, our spine is, as you know, previously also we have discussed in our videos how the structure of the spine and the various problems and elements which are associated with spine we've already discussed. But just to have a quick recap, our spine is made up of chain of bones, like a chain of bones. 31 bones are there. 7 of them are in the neck, 12 of them are in the chest, 5 of them are in the back, and another 5 in the tailbone. So total 31 bones are there, and this forms a very mobile unit. This forms a very mobile unit, and these small bones are joined by joints which includes the jelly-like material which is known as the disc, and then there is facet joints, and then they are covered up in the front by a ligament called ALL, and in the back by a ligament called PLL. Now, the problem in ankylosing spondylitis is that it affects the whole motion segment of the spine. What it means is that it affects the way the spine moves. It affects the flexibility of the spine. To start with, it starts with inflammation, means there is intense pain, and then it goes into stiffness. Now, people with ankylosing spondylitis, they may have a change in posture, stooping posture and all, which is a result of fusion. The disease starts as inflammation in the disc. What is disc? Disc is the jelly between the two vertebral bones, and it starts as a subchondral inflammation between the disc, and the disc narrows, and finally they start fusing with each other, thus inducing stiffness. Along with that, the facet joints which are behind the disc, they also start fusing, and the flexibility of the spine is greatly jeopardized. The reason being that there is a ligament in front of the spine. It's a tape-like ligament in front of the spine which is known as anterior longitudinal ligament. That ligament is flexible like a tape, but because of ankylosing spondylitis that becomes brittle because it gets calcified, so it becomes brittle, and that restricts the movement in the whole of the spine. Along with that, the ankylosing spondylitis is characterized by sacroiliitis. There is gross sacroiliitis. What is sacroiliitis? This is the sacroiliac joint. The place where the spine and the pelvis bone meets, there are two sacroiliac joints in both sides. So basically it's a lower back. So it is characterized by inflammation in the sacroiliac joint. So as we can see, it involves the anterior longitudinal ligament, which is known as ALL, and that involves, there is intense inflammation in the sacroiliac joints. Sacroiliac joints is the place where the spine and the pelvis bone meets. So there is one sacroiliac joint on both sides, right and left side. And the inflammation is in lower sacroiliac joint is felt as intense pain in the lower back. This is how a healthy spine looks like. There are a chain of vertebral bones, and between these bones there is something called gel-like material called disc. And behind this disc is joined by facet joints. So this is how a healthy spine looks like. In ankylosing spondylitis, there starts inflammation in these discs, and this inflammation in the disc leads to stiffness and fusion of the bones, and thus diminishing the flexibility in the bones. Along with that, the facet joints are also affected because of inflammation. So this is how a normal spine looks like in the cross section. This is a cross section. So in front there is a flexible tape-like ligament which is called ALL, anterior longitudinal ligament, and this ligament gets calcified because of intense inflammation. Now this calcification of this ligament leads to brittleness, and there is greatly jeopardized flexibility. The person cannot bend forward, the person cannot turn, and before that there is intense pain. And along with the disc which gets affected, behind this is the facet joints. So these joints also get affected. Before that we have seen in our early series water facet joints and how they are made up. So these facet joints also get affected. This presents as back pain and gluteal pains. Now the basic investigation for back pain and back related issues is X-ray and then MRI, and if needed CT scan. So X-ray is in ankylosing spondylitis in advanced cases is very typical. What happens is, because the discs are fused, the front ligaments are fused, the back ligaments are fused, the X-ray appears as if we are looking to a bamboo, and this is known as bamboo spine. This bamboo spine presentation which we find in X-rays in ankylosing spondylitis is very typical, very characteristic of ankylosing spondylitis. But of course this stiffness and calcification and all appears only in advanced disease. Before that, person has severe pain in which X-ray may be normal. X-rays may be normal. So there are other major and minor criteria to diagnose ankylosing spondylitis. Similarly, it can affect the neck spine also. Neck spine is made up of 7 bones which are known as vertebral bones, and that is the most flexible area of spine. We can turn our head anyway, front, back, we can turn up, down, sideways, we can rotate. So that the spine, the cervical spine, which is the neck spine, is the most flexible area of spine. And because of ankylosing spondylitis, the neck gets fused in one place. For example, if it is fused looking downwards, then it is very difficult for the patient to look upwards. The person with fused neck cannot elevate the head or turn right, left, up, down, nothing is possible. This is a very difficult situation to deal with, and the treatment is also very difficult. But all these X-ray changes appear only in advanced disease, only in advanced stage of the disease. Before that there will be pain, and X-rays will be normal. So that is the problem. And several times we do MRI if X-rays are normal. MRI can also pick up some signal changes, which will show eventually how MRIs can pick up. So this is what I was talking about. In advanced cases, the spine gets fused, the ligaments get fused, and it appears as a one stiff bamboo, which is known as bamboo spine. But in earlier cases, in early stages of the disease, there is pain, but there is no X-ray findings. In that cases, sometimes we can get signal changes in MRI. Like MRI basically picks up the magnetic signals, and there are normal signals, and then altered signals can be picked up in much earlier stage of the disease before the X-rays can pick up any changes. So MRI also form essential part of the workup to diagnosis if needed. So we have seen that the ankylosing spondylitis affects the spine, which involves the lower spine, that is the back, the sacroiliac joints, the cervical spine, that is the neck. But along with that, it affects several other parts of the body, which include the rib cages and the chest also. Now our rib cage, it's made up of 12 ribs on each side, is a very expansile part. With deep inspiration it expands up, and with expiration it goes back. So because of ankylosing spondylitis, it starts fusing the joints. The movement of the rib cage is greatly jeopardized. So we can measure with tape how much the rib cage is moving on deep inspiration and how much it is moving on deep expiration. So that movement is greatly affected in ankylosing spondylitis. Thus it affects the breathing capacity of the person. It affects the tidal volume, it affects the reserved volume, it affects the overall expansion of the lungs and chest walls, and affects the breathing capacity of the person. Most commonest presentation of ankylosing spondylitis is with back pain. Person presents with back pain, and before stiffness appears, before fusion starts occurring, we have to diagnose it, we have to pick it up, and we have to do multiple stretching exercises are done. Multiple stretching exercises like yoga and all other stretching exercises are done to keep the stiffness away, to minimize the stiffness or to delay the stiffness. So flexibility exercises form a very important part, undoing or minimizing the stiffness in ankylosing spondylitis. Stiffness involves mainly the joint, mainly the spine and the rib cages. Along with that, ankylosing spondylitis, in many times it affects the hip joint, which presents as a groin pain and thigh pain, sometimes radiating to knees. So that groin and thigh pain is because of hip joint affection of ankylosing spondylitis. There is a painful limp. Person may be limping, they have painful limp, and the rotational movements of the hip joints are greatly diminished. In earlier stages we can X-ray, we can pick up changes. If needed, if we have doubt, we do MRI to pick up even earlier stages, signal changes. So we can see that in early stages, when the ball and socket joint is preserved, but in later stages when the fusion occurs, the ball and socket joint is not preserved, and it appears as if the ball is fused with the socket. There is no space, it becomes one bone type. This is known as ankylosis. Now this ankylosis can be fibrous ankylosis or bony ankylosis. In bony ankylosis, we can clearly see that the bones have fused. In fibrous ankylosis, we can still see in X-ray that joint space is preserved, but movements are greatly diminished, and there is pain in hip joint which can be radiate down the thighs to the knees. Several times pain in hip can be felt at knee also, because hip and knee have the same nerve supply, and in the thighs also the same nerve supply. So it appears that the groin pain is coming down to the knees through the thighs. And along with that, the person has got a painful limp, painful walking. All these things are there. Rotations are decreased in hip joint. Now we saw that ankylosing spondylitis affects predominantly the spine, the upper spine, neck, the lower spine, the back, and even the sacroiliac joints. It affects the rib cages, it affects the hip. Along with that, it has got other non-skeletal manifestations, which means it has got manifestations which are not part of the bones. Non-bony manifestations are also there. For example, the person may feel chronically fatigued. The person may feel they're tired much more easily. There can be changes in the eyes, which are known as uveitis. Any ophthalmoscopy examination should be able to pick up the eyes changes, which are known as uveitis. There is depression, there is heart disease, and because it's an inflammatory disease, it affects our intestines also, which can be which is known as inflammatory bowel disease. It can cause other immunogenic skin problems like psoriasis. It can cause heel pain, and it can cause rarely softening of bones, but majority of the times it can cause thickening of bones also. So just to have a recap, ankylosing spondylitis non-bony manifestations, non-skeletal manifestations include fever, fatigue, pain in lower jaw. In eyes there is uveitis, redness and inflammation in eyes can be seen, and any person with ankylosing spondylitis should have regular eye checkup to minimize any problems with uveitis, because this uveitis, the changes in eyes, are a very characteristic feature of ankylosing spondylitis, and it is used as one of the major diagnostic criteria of ankylosing spondylitis, major clinical diagnostic criteria of ankylosing spondylitis. There can be pain in rib cage, such as especially when you exhale. There can be chronic pain and stiffness in the lower back, where spine meets your pelvis, that is known as the sacroiliac joint, the joint where the spine meets the pelvis. There can be chronic back pain, chronic pain can be there. Inflammatory bowel disease can lead to diarrhea, bloating or other gastrointestinal symptoms. Pain that get worse with inactivity. Now most of the stiffness pains of our musculoskeletal systems in ankylosing spondylitis, they get worse with inactivity. For example, if a person is sitting idle, person is sleeping, the pain increases once the person gets up. So it is very recommended to have an active lifestyle, do regular stretching exercises, flexibility exercises in ankylosing spondylitis. And like most of the chronic pain, it gets better with hot shower or heat. There can be other skin manifestations like psoriasis. Eye manifestations, as we discussed, is very characteristic and one of the diagnostic criteria is used in ankylosing spondylitis. There is uveitis, there can be redness of eyes and other features which need regular eye checkup. There can be alternating buttock pain, which is because of the facet joint arthropathy. The facet joints inflammation pain is characteristically, it comes to the buttock areas. And there can be pain in your heel or foot in ankylosing spondylitis. Hip replacement, if hip joint is affected in ankylosing spondylitis, hip replacement is a life-changing surgery. Hip arthritis is very, very painful, very excruciating. Person is not able to walk, person is not able to sit on chair, and the person finds very difficult to sleep because of pain, excruciating pain which occurs at night, and there is difficult in changing posture. For example, turning sides is very difficult because of hip affection. And most of these patients are very young. So hip replacement, once the hip is replaced, if it is needed. Now it is very important in ankylosing spondylitis to see the source of the pain. We have to be very correct in diagnosis whether the source of pain is from the lower spine or the hip. The lower spine pain is felt in buttocks and the hip pain is felt in groin, thigh and knee. So the diagnosis has to be very correct when we are dealing with hip replacement in ankylosing spondylitis. But if hip is affected, if hip is painful, if there is restricted movement, there is flexibility, there is stiffness, then hip replacement is a life-changing surgery. A person who is not able to sit, walk, suddenly starts walking and sitting in a chair from the next day, and the person may start jogging from 1 month. So hip replacement is a very successful surgery if needed in ankylosing spondylitis. And several times both hips are affected, then we may do both knees together in same sitting. If one hip is more affected, we do the more affected side first, and if needed later on we do the next side. Sometimes knees are also affected in ankylosing spondylitis, and then we go ahead with knee replacement. Although knees affection in ankylosing spondylitis is far less than hip. Mostly it is the hip that is affected. So we had a brief discussion about ankylosing spondylitis, what it is, what are the manifestations, and what are the treatment options. If you have any queries, any further queries, please do mail me at my mail ID santdr@gmail.com. It's SANT, T for telegraph, D for doctor, R, santdr@gmail.com. And you can WhatsApp your queries to me on my WhatsApp number 9831911584. 9831911584. So hope you had some insight about ankylosing spondylitis. If you have any queries, feel free to contact me, and if you need any treatment, please come to Kolkata. Over here, me and my team will be giving you the world class, the most effective, the safest and the best treatment for ankylosing spondylitis, whether it be medical treatment, whether it be hip replacement. We'll give you the best, safest at the most affordable prices for our friends right here in Kolkata. So please do come to Kolkata. Please do contact us. Thank you.